doctor. It's very early days, but it has been written. It may well take 7 years of an apprenticeship to become a doctor. But what I will say is it does link into this, because it could be something that a paediatric nurse would be able to APEL something in, you know, that's your prior learning, knowledge and experience and things like that, that would go towards your overall qualification. So it might knock a year off, but it isn't necessary. If you want to be a paediatrician, I would recommend going down the medicine route, if I'm honest. If that's your ultimate goal, you could end up not wasting time. Of course you won't. You'll look after patients and children along the way. But I think if that's your ultimate goal, then go for that and go down the medicine route.
No, that's great, thanks. And also, Rosie, good question. And these are the questions to be asking now, which roots in, so brilliant. I'm going to ask this question to Felicity. So is shadowing an NHS professional still a thing, or will it be allowed to get them soon? What was your experience? Did you, when you went into podiatry, did you do any kind of work shadowing, and does anyone shadow you now, and how's that changed with COVID, I guess?
Yeah, so luckily my mum's a physio in the NHS trust that she lives by, so obviously that's a lot easier when you're sort of in there, and you can ask colleagues a lot easier, and then going through the official process of doing work experience. So yeah, I think I got 2 days shadowing, 2 full days, which was great. And in terms of work experience now, our trust haven't had anything or anyone sort of come forward who's interested since or during COVID, but I'm sure a lot are offering sort of virtual work experience, and that can be easily done. Obviously with going through the official processes and making sure patients are happy and all of that stuff. But I would definitely, like I said this in pretty much all the breakout rooms, just link in with your local trust and see what they're offering. And now things are sort of easing a bit with testing and all of that stuff. You might be able to get in and do a face-to-face session.
Yeah, no, that's great, and great to hear. I don't know if there was anyone that wanted to add anything else in terms of work experience there, but we've had another couple of good questions come in too, which is Ellen has asked, how hard is it to manage personal and family life when working full-time, or would it be easier to sacrifice that part? Sean, I'm going to ask you that question. Work-life balance, what does that look like?
I don't think sacrifice would be the right word. I think if you start talking about sacrifice, then you know, to do a good job, you need to be in the right mental space. And if you think about sacrifice, probably after a couple of weeks, you're going to be completely stressed out and not be able to do your job. I think what you need to consider is to do probably a compromise. If you have a family, for example, let them know what are your shift, get organized with them. If you have a partner, the same. For example, when I was working in the ward and I was doing shift, my partner as well was doing shift. We are both nurses and we were doing 12 hours and a half shift, both, and always opposite. But we try to organize our week in a sense that when I was off, I could do the cooking or the shopping. If he was off, he could do the same. I think it's about organizing. If you are on yourself, then probably, you know, organize your week based on your shift and then plan something to take your mind off, do something for your mental health well-being. It's difficult, but you need to get used to it. You know, it's like every job. You'll need to compromise and organize your week based on what you have to do. But sacrifice is not the right word, because it feels like that you're missing on something, and then you feel that void, and then you will feel bad about it, and that will compromise your job. So you need to be in the right mind space.
No, definitely. And I think it's a good thing to be thinking about work-life balance, but I do agree. Does anyone else have any kind of coping mechanisms that they use, which would be good advice to kind of give to students as they venture into working for the NHS?
Ellie, I was just going to say that the NHS, obviously, when you're training and things, it wouldn't be, you know, you would have to do the requirements of your course, but the NHS as an employer does allow flexible working. So, you know, a lot of people within my area, they do set shifts, or they do particular rota every month, because actually that suits them in terms of childcare and things like that. Obviously, it's all agreed at ward level and with your managers and things like that, but it is something that the NHS do offer. So it may be that actually you do have that compromise whilst you are training, and that would be the same as undertaking any course. You do have to compromise to obviously reach your goal. But at the same time, you will be socialising, you will be making friends. You know, a large part of working in the NHS is speaking to people, speaking with your colleagues and these kind of things. So, you know, you do get a bit of socialisation within your working within your NHS course and these kind of things.
Great. No, thank you so much for adding that, Lauren. That's a great point. So we got a question asked a few minutes ago by Javaria, which is saying, could you explain how to get into advanced clinical practice? Is anyone able to jump in there?
I'm happy to answer that. So advanced clinical practice, that's something that you would do later down in your career. It's something that is, as I say, it's master's level. So you need a degree before you can do a master's. So it would be when you are practicing as a registered professional, either nursing or allied health professional, and then you want to specialise in a certain area around advanced clinical practice, and then you would go into that. But it's not something that you can do without doing any of that first.
Okay, brilliant, thank you. I know I'm conscious of time, so if anyone does need to drop off from the panelist side, then don't worry at all. We've just got a few questions still to go, and then I'll do a bit of a wrap up in the next 5 minutes. But Clarence has asked, there are some courses which need biology and another science. I do biology, but also do psychology and sociology, which is human sciences. Would these two A levels be fine to go into a healthcare course? And I guess it is quite subjective, isn't it, with the different roles and the different kind of healthcare professions you're looking to go into. In terms of going into healthcare roles, what do people have to bear in mind in terms of sciences and different subjects they're taking?
To be honest, it's a bit of a minefield, if I'm honest. All the universities do set their own entry criteria, and it's causing us a bit of a headache, honestly, in terms of apprenticeships at the moment. So just trying to get a uniform across the board. All the HEIs are a business in their own right. They can set their own entry criteria. There is something called the Council of Deans for Health, and they try and sort of, maintain it the same across, but you know, at the end of the day, they can ask for what they want, and sometimes the universities do look at things on a case-by-case basis. So it's always worth applying for as many different universities as possible, and see what comes back. But and you'll find this is when people say, oh, I got accepted to this uni but not this uni, and it'll just come down to entry criteria and what that university feels is needed for that course, and the other university feel it isn't. So there's not really an answer to that as such. There was a question a bit further up about become a doctor without a chemistry GCSE or A level. Again, I don't really look after medicine, but there is lots of stuff online around entry to medicine, and there's also many sort of work experience courses, webinars and things like that. And Ellie, I don't know if you've got anything like that you do. You probably do. So yeah, it's just not one size fits all, I'm afraid.
Yeah, absolutely. And that's the value in our kind of follow-up process from today as well, just making sure that Clarence, for example, we can work through with you what are those healthcare routes that you're looking to go down, and how can we help you with, signposting and marrying the dots up between the two. Conscious of making sure that I can cover off that follow-up piece. As a kind of final note from the panel, I wonder if it's nice to end, if there was one kind of key takeaway that you'd like to kind of share. I know it becomes difficult as you get to the last person on the panel, so more an experience or a takeaway that to kind of round off today, if you don't mind. And I might start with Gabriella, is that all right if I start with you?
This is about takeaway for to suggest as a suggestion to people.
Yes, a kind of a final point, I guess, as we leave today, knowing the students are kind of just about to set off and after being with us today.
Well, I think first of all, ask yourself what you're really interested in, because I know there's been some talking about medical nursing. And then once you make that choice, go there, as I said before, with that passion. And as I said, in the breakouts room, with curiosity. When you start your course and you will start your placement, go there with an open mind, ask questions, network with people, and get to learn their stories, where they are there, how did they do it, get informed. I think this would be my takeaway. I said more than once, sorry. Probably be passionate and be curious, ask questions.
I've also stumped you all with a very hard question to finish on, but yeah, I guess over to you then, Felicity, if that's all right. You're next to my screen.
Yeah, I guess I'd say the same, because I used to be the clinical lead for students in our trust as well. So, you know, the best students that we have are those that are super enthusiastic. You know, I say to them, I'm open to them, and I say, I don't know everything, and I'm not going to know all of your answers, but we can go away together and look it up together and learn together. So it's not about, you know, stressing that you need to know everything on placement. Just be, yeah, ask lots of questions and be enthusiastic, willing to get stuck in, and just, yeah, and also, like Gabriella just said, networking. I only recently started going on Twitter, and I set up like a professional account, and gosh, there's been like so many like things that I've got involved with just from going on Twitter and stuff. So get a Twitter profile set up, follow a load of people that you know, that are in the profession that you're particularly interested in, and you'll see loads of different stuff, you know, whether it's free training or getting involved in loads of different sort of side projects and stuff. So yeah, I would definitely, and just from being working in the NHS this past year, it's definitely been really rewarding, and just, yeah, nice knowing that you're part of like an essential service, you're a key worker, and yeah, I would definitely recommend a career in healthcare for sure.
Amazing, thank you. Sean, you're next on my screen. Are you all right to jump in?
Yeah, I sort of just re-echoing what Gabriella said. Passion. There's really no career you go into that is not challenging, I'll tell you that. And the only thing that gets you through it is your passion. If you have a passion for a particular career, no matter what challenge is thrown at you, you will fight through it. But if you are not passionate about it, it's just that nonchalant attitude comes in, and then that sort of flags failure. But your passion will push you through if you have it for whatever career. So don't let it be because my friends are doing that because I'm doing it, or because I feel this, I'm doing it. Is what you have passion for, you should do. Okay? And I wish you all the best. Healthcare is wonderful. We expect to see you in a couple of years. Thank you.
Brilliant. And Lauren, I'm sorry, maybe the hardest slot, following everyone to finish off the day, but yeah, over to you.
I would reiterate what everybody said. You know, working within the NHS is a really rewarding career, but you do need to have that commitment and that passion. I would say do your research in terms of what pathway is best for you, because, you know, at the end of the day, this is your life, this is your career. As Sean was saying, you know, don't just pick it because somebody else is picking it. Actually think about what pathway is going to suit you the best, and what's going to suit your personality, what's going to suit your lifestyle, and these kind of things, because actually that's the way that you're going to be happy and find a career that suits you and makes you, you know, impacts on your life, and you have that passion and you have that commitment, and you're able to work, you know, for years within that career.
Brilliant, thanks so much, and thanks for all of our panelists for getting involved in the sessions earlier, for being here to kind of field these questions at the end of the day, and for also just showing, you know, your own passion for the different roles you're doing, because it's really inspiring. I always leave these days thinking, oh, I'm going to go and work for the NHS, right? Because it's so nice to hear. Students, I have one ask for you today, so I'm just popping a survey in the chat box. Anyone that can't see it, then let me know. But it's really important you fill this out for us, because we really want to help you. And the way we're going to be able to do that is by understanding which route do you want to take, where do you want to go, do you want any support from us. So it also asks a little bit of feedback on the day. So you can let us know what your favourite sessions were, things that we could do differently, because we're by no means perfect either. No one is. So it's always a learning curve. I'll pop it in the chat again afterwards. It's great to see those thank yous coming through. I hope everyone's found today useful. We're continually amazed by the dedication of our students to kind of join us, and those classrooms that have been on today. Thank you, teachers, for kind of coordinating that. We are here to help you after today. Please don't leave it at today, because even though it's been absolutely brilliant and we've all learned a lot, then we can help you with those next steps, which is really, really important. So do take some time to fill out the survey. Here's me going to resend it a few times while you all just send your nice messages, which is really nice. But I will hang on here for a few minutes afterwards, just to make sure that you do have that, and you can just fill it out for us quickly, because that would be really helpful. Well done, everyone. Well done for getting involved. Thanks to our panelists, and have a lovely rest of the day.
Bye.
Thank you and good luck.
You.
Bye.
Bye.